Next, we're going to turn to Jason Mercredi, who does some amazing work, I hear, as he leads the team at Prairie Harm Reduction in Saskatoon, which is a clean place for people to safely consume drugs under the supervision of staff who can offer social supports. Jason's going to talk to us about how rising mental health issues have contributed to a record number of overdose deaths in Saskatchewan, prompting health officials to deem it a crisis. With no new provincial funding, the organization is relying on small businesses and public fundraising to keep the doors open, which I'm sure is a familiar story to many in the community. Jason, I'm going to pass it over to you.
Yeah, thank you for having me. So I'm just going to open up my slideshow. Can people see that? Perfect. All right, so philanthropy in addressing Canada's overdose crisis. So our service is Prairie Harm Reduction. We're located in Saskatoon, Saskatchewan, and we operate a number of programming. So the first one that we operate is the Family Support Program. They run an outreach team, a youth home, and the Oski Kesikow apartment that we're opening up next month that's going to be reuniting parents who have lost their kids to the foster care system with their kids. And so we're going to be taking kids out of foster care and reuniting them with their families. That's something we haven't announced publicly yet, but we're pretty excited about it. We also have our support services department that does outreach, case management, Naloxone training, operates our safe consumption site, and our drop-in center. So we operate quite a large number of services, and we do it on a fairly thin budget, which I'm sure is pretty commonplace for all of you. And we prioritize hiring people with lived experience, whether that's people who are Indigenous, people who have experienced homelessness, people formerly living with addictions or currently living with addictions. We try to hire people with lived experience as best we can. That said, all of our staff are paid the same wages. We don't have a staffing wage discrepancy if you're quote unquote a peer versus a non-peer staff. And we think that that allows us to retain people and recruit people in a much more holistic way. So safe consumption sites. So for those of you who don't know, Canada's in the midst of overdose crisis. A lot of people are dying. A lot of people are dying. And so we're in this weird spot where we need services like ours. Ours is a safe consumption site. So what is a safe consumption site? It's basically a federally approved a building where people can come and use drugs under the auspice or the observation of a medical professional. Our safe consumption sites are federally approved. They're provincially funded in theory. And some major cities fund these services. So Toronto and Vancouver kind of being the main two, as those cities control health spending. But you see that there's an immediate disconnect between the fact that the federal government approves it and the provincial government is expected to fund it. And so, across the prairie provinces and in Ontario, you have very hostile provincial governments to the federal government and vice versa. And so a lot of times people don't want to do it because they can't take all the credit for it, or there's an ideological difference. And so, we have hostile governments in Alberta and Ontario. We have reluctant governments to fund these services in Saskatchewan and Manitoba. And I say there is a difference there because in Alberta and Ontario, they're actively trying to cut funding for different programming. And in Saskatchewan and Manitoba, they're just like kind of hands off and not providing financial support to these types of programming and even for ours. So we do receive provincial funding for our case management programs, but we don't receive any funding for our safe consumption site. So it leaves us in this really big limbo where we're expected to watch people die because of an ideological difference and people don't want to fund it at the provincial level. So why did our organization need to open up a safe consumption site? So one is we've historically, Saskatchewan has the record HIV rates in all of Canada. So we had 199 new infections in 2019. That was an 18% increase. What makes us very unique is that we're the only province that the main mode of transmission for injection or for the HIV transmission is shared drug equipment. We have approximately 26% of people living with HIV not aware that they're positive in Saskatchewan, and that's really not great because it shows that we're not doing a good job of connecting with these folks. And it's important that we do, because when people are aware of their HIV status, they're much more likely to change their behaviors and reduce risk so they don't expose somebody else to this problem. So our building, we relocated from the neighborhood of Mayfair to Pleasant Hill in 2019. We bought a new building. It was ideally situated. We're located by pretty much every service provider you can want to be located to if you're going to want to operate one of these buildings. We're right in between the Westside Community Clinic, which is run by the Saskatoon Community Clinic, and it's the busiest clinic that works with people who use drugs or people living with HIV in Saskatchewan. And then on the other side of us, we have the Saskatoon Tribal Council Health Center, which is the busiest needle exchange in the entire province. So we're situated literally in between it. It goes Saskatoon Tribal Council Health Center with their needle exchange, us, and then the Westside Community Clinic. We're also just down like a kitty corner to Brief and Social Detox is through our alley. St. Paul's Hospital is half a block away. Sanctum, which is a HIV hospice, is a half a block away. We have Oris Clinic and the Positive Living Program. So we have an rapid access methadone clinic, kitty corner to us. So we're really where we need to be. And even with that, we couldn't get provincial funding. So not just to where we need to be, but here's a map. So down in the bottom blue corner on the bottom is Pleasant Hill. That's where a majority of overdoses were happening. And if you look at the top of the map, it says 2018. It maps out the overdoses for all of 2018 where people had to be brought to the emergency room. There's only 245. The last public available data we had for overdoses, not overdose deaths in Saskatoon, we were dealing with upwards of 150 a week. It was about 120 on average. And so that gives you an idea of how bad the problem's gotten when we've gone from 245 a year to 120 on average a week in just 2 short years. Then we asked people who use drugs where they'd like to be located, and overwhelmingly the location was in the bottom left there with St. Paul's Hospital. You can see the Saskatoon Tribal Health Center. We're located right beside that location. Our old location and our old name is at the top with Aid Saskatoon. And a lot of our folks said that they would like us to operate the site, which is why they chose us as one of their preferences. But we realized through the survey the majority of our clientele were actually living in Pleasant Hill. So it made sense for us to move our location down there. Then we look at historic HIV rates, overwhelmingly Pleasant Hill. So we're ideally situated. We're right in the heart of the HIV epidemic. We're right in the heart of the overdose crisis. And we're where clients want us, and yet we still couldn't get provincial funding. For us, I'm just going to go quickly through this. Transparency was key right from the start. So we did a community consultation. We wanted to maximize local contribution and minimize outsider contribution. By that, we didn't want people that didn't live in Pleasant Hill to be talking about solutions for Pleasant Hill. The Pleasant Hill is predominantly, well, it's the most impoverished neighborhood in the city, predominantly Indigenous, and a lot of people tell Pleasant Hill what they want, and we didn't want that to take place. And so we maximized Pleasant Hill's contribution and minimized the outsider contribution. The one thing when you're doing these types of projects, whoever's leading the projects need to be at everything. So that's me. And so I'm at community meetings all the time. I'm online. People see me in the media. I try to be as active as possible to talk about this because people need to know that there's somebody responsible for these types of sites when you're wanting to engage the public. We educate the community. We use traditional media, but we really do maximize social media. I was going to put some of our memes on there, but they're probably a little bit too racy for this presentation. But our use of social media has allowed us to be the success that we are today, and it's part of a media strategy and public engagement strategy. But we use social media because a lot of times what we find when you're talking about mental health is when you use traditional media, they misrepresent or they use stigmatizing language or they don't get the proper messaging out. So let's just cut out the middleman and we go after it. That said, we have really good media relationships, and our media in Saskatoon is really well informed on the overdose crisis and mental health crisis. And you know, we're pretty active in working with them to make sure that they're using the proper language and they're not further stigmatizing the population. And it's really allowed us to get all segments of the population to engage on this issue. So we did a door knocking campaign through community consultation. I'm not going to bore you with the details, but basically we knocked on every house in Pleasant Hill and it took us 2 months. 74% of residents were in favor, which shocked a lot of people. 15% opposed, 11% neutral, 27 organizations in favor, 3 opposed, 5 were neutral. 87% of people who used drugs surveyed in 2018 stated they would use it as a safe consumption site and that Pleasant Hill is the preferred location. We have 7 booths for injecting, ingesting, and snorting, and we have 1 booth for safer smoking. We're now the only booth for safer smoking in the country. This isn't just a free-for-all. People come in. It's a very sterile facility. This is a terrible photo. It's very blurry, but it's a very sterile facility. If you walked in, it looked like any other medical clinic. And we did that intentionally when we're working with folks so that we could get better buy-in from the mainstream. on it. And now we're working on, putting some graffiti tags up and different types of art up. But the space is a federally regulated facility, and I think we have one of the best ones in the country. We're just not funded. And so creative funding options are needed. And so we really relied on social enterprising at the start, because we didn't think in Saskatchewan, we didn't think harm reduction was going to be a catchy or something that people wanted to back. It's very, harm reduction can be viewed as very controversial. And so we focused on a online clothing store. What we didn't know when we did the online clothing store is that really ingratiated us with places like the Chamber of Commerce and the business community, because we're now running a small business. And so running a small business is hard. I can tell you that from running this store, it's brutal. And so they really liked our approach, and they liked the fact that we were engaging through social enterprise. We were denied funding in 2020 and 2019, and we became fairly aggressive in our advocacy approach. And the money started pouring in once we started becoming aggressive in our advocacy approach. Basically, we thought, what's the point of being polite? Polite got us nowhere, so let's fucking go after it. Sorry, I didn't mean to swear, but let's go after it. And so we have been. And as a result, we've had a lot of success. But a lot of it's based around our social enterprise. So these are blankets, but these are designs that we used on bunny hugs or hooded sweatshirts, t-shirts, blankets, beach towels, you name it. We've done a lot, and we do limited edition runs, and we try to have a message on our clothing. So you can see this is from our tarot card design that we did about a year and a half ago or a year ago. Here's our justice one that brings awareness to missing and murdered Indigenous women. One of the things that we do with all of our lines is we always donate, we pick one of our designs and we donate 50% of all the items with that design on it to another nonprofit or charity. And so this one was for Choke Cherry, because they do a lot of work on Choke Cherry youth, Choke Cherry Studios, because they do a lot of work with youth in the community on missing and murdered Indigenous women. And that was designed by one of their youth as well. This is our judgment one. So one of our moms in the community, Maria Jarides, she lost her son to an overdose. We asked if we could use him for the angel messaging, and it really allowed this like powerful message to come through about how the human toll this has on it, and what she's been able to do with his legacy and really rally the community, because she's kind of a titan in our city for the awareness campaign. And so it shows people rising from a wheat field. This is one of our ones from our newer designs. So it's just a fun design, be heard. It has naloxone on it. Encouraging advocacy. Here's one of our ones that is based off Akira, which is an anime, really cowboy themey, futuristic theme. Got a lot of people interested. And then we had a raccoons theme one that was, we're really looking to get the college kids that are partying. And then as a result, we were able to raise $180,000 in 1 month. So this is just from April of this year. We didn't plan a fundraising. We planned our clothing store, which we were guessing we were going to raise around $20,000 to $30,000, and then our estimating. And then the business community, when we got denied provincial funding, really rallied behind us, which was surprising to us, because we now have an official realtor. There's a butcher shop that runs a line of smokies for us. We have a nerd store that sells socks for us. We had cinnamon buns. We had tattoo parlors, drag shows, fitness classes. You really name it. We've had everything. A movie theater just did dedicated popcorn sales for the month to us, and we were able to raise a lot of money. And really, we didn't plan any of it, which was amazing for us. So the future for addressing the overdose crisis, the big question is sustainability. I can tell you from trying to fundraise as much money as we need to operate one of these facilities is it's brutal. Like it takes everything you got, and the time commitment is no joke. So that I can pay my staff, I'm probably working 60 to 80 hours a week most weeks. It's pretty intense. So we're hopeful that we're going to get provincial funding, and if not, we're going to be doing more social enterprises. So the store is kind of just the start of it, and then the digital aspect of what we do with our fundraising and community engagement, community education, can't be understated. And we don't have anybody on staff that does that, and so I do that as well. And so really that push and that drive to get this thing off the ground has been what's carried us forward. And luckily the community's backed us, but we're not sure how long that's going to be able to keep going. And so we're very hopeful for provincial funding in the future. These are just some advocates across Canada that are working on this very important issue. This is a legitimate life or death issue when you have 2,000 plus people dying in some provinces a year, and 20,000 and it's just the death toll is starting to get pretty intense, and it's taking its toll on staff and community members and family and friends. So that, I'll say thank you.